Okay, well, I think we can go ahead and get started. Welcome, everyone. Thank you so much for joining us today. Everyone right now is in listen-only mode. If you could please just mute your phones and make sure there's no background noise, that would be great. If you have any questions as we're going through the presentation, please be sure to post them in the chat pod. We will read and answer all of the questions at the end of the call. My colleague, Sarah Stolberg, will be joining us as well as a co-presenter. She's our Senior Manager for Adolescent Sexual Health here at NCSD, and she'll just be helping to address any questions and queue up the questions for the end of the call. Today we're going to be talking about the new funding opportunity from NCSD to increase the capacity of health departments to prevent HIV and STDs in adolescents through CDC-developed school-based approaches. And I'm Lily Pinto. I'm the Program Manager for Adolescent Sexual Health here at NCSD, and I'm going to be walking you through the information session today. Okay. And here's our agenda. We'll be covering the basic outline of the RFA, all of the eligibility requirements, what happens if you are ineligible, our expectations for your proposals if you do choose to apply, deadlines, and any questions you have. And just as a quick update, if you find that you are ineligible to apply for the NCSD opportunity as we are reviewing the eligibility requirements, that's okay. We do ask that you please stay on the line until we are able to go through the next slide after the eligibility requirement slide that addresses a few of the other funding opportunities from our partners, which you may actually be qualified for. So the following information is included in the RFA, and it's just a brief overview of the objectives of the opportunity. As mentioned in the announcement, NCSD has received funding from the Centers of Disease Control and Prevention's Division of Adolescent and School Health, which is known as DASH, to increase education of key stakeholders on CDC-developed school-based programs to advance HIV, STD prevention among adolescents aged 10 to 19 years old. Some of you may be familiar with DASH, but for those who aren't, DASH provides funding and technical assistance that enables state and local education agencies to deliver HIV and STD prevention programs that are scientifically sound and evidence-based. Through this initiative, NCSD aims to increase the capacity of health departments to implement the school-based approaches for HIV and STD prevention in partnership with education agencies. Okay, so what are the CDC-developed school-based approaches? There are 3 school-based approaches, which are health education, health services, and safe and supportive environments. Just a quick overview of all 3 of these. Health education is designed to help adolescents acquire the essential knowledge and critical skills needed to prevent HIV and STDs through the use of grade-specific lessons and materials that are medically accurate and developmentally and culturally responsive. The health services approach facilitates access to critical health services, including HIV and STD testing and treatment, contraceptive services, pregnancy testing, condom provision, HPV vaccines, referral system development, and anticipatory guidance and health counseling. Safe and supportive environments. This approach promotes and provides safe and supportive district and school policies and practices to create positive learning and teaching environments for students and school staff through bullying and sexual harassment prevention, promoting school connectedness, and promoting parent engagement in schools. So that's just a quick rundown of DASH and the objective of these microgrants and what the school-based approaches are. Now to the good stuff, the eligibility and the funding piece. Now that you have an overview of the goal of the funding opportunity and the school-based approaches, let's discuss your eligibility to apply. You must meet all of the eligibility criteria that is listed in the RFA. It has to be all of the criteria, not just one or another. It has to be everything. If as we are going through these requirements, you realize you might be ineligible, please do plan to stay on the line to hear a little bit more about the similar funding opportunities through our partners. You are eligible to apply for the NCSD opportunity if you are in an area not currently funded by DASH. You can see in this map here on the slide that the states in pink and the cities or counties that are marked with blue dots are currently DASH funded. This information can also be found on the DASH website, and I'm happy to send that link if anybody is interested in that and learning more about that. Okay. If you are a state, territorial, or tribal nation not in any of these areas, and you are a health department STD program, you are eligible to apply for the NCSD opportunity. You must be in a jurisdiction that demonstrates need based on epidemiological data. You must be able to demonstrate the commitment of your health department leadership and capacity to implement this project. There must be demonstrated interest from your education agency to work on this project as evidenced by the inclusion of a letter of support from the education agency as part of your application. And then just to illustrate this a little bit further, there's a possible scenario I'd like to share with you in terms of eligibility. Say you are a state health department STD program and you'd really like to apply for this funding, but you are short on time and resources. So you'd like to apply through another division of your health department. Unfortunately, you won't be able to do so. The application will need to come directly from the STD program. However, you can have another branch write the majority of the application, but you will need to ensure that the LOI, so that's the letter of intent to apply, and the education agency letter of support must come from the STD division. Another option, you could also apply for the grant through the STD program, and then the STD program could award a smaller amount of the grant as a subaward to another division of the health department. So if you have any questions about that, we can go over it at the end. Please type them into the chat pod. Okay, so now let's review the funding amount and the process. NCSD will select up to 3 health departments and award up to $20,000 per selected agency for the project awards period of August 2017 through September 2018. NCSD will pay each selected health department one installment of $20,000 upon award. Phase 1 of the project will begin on the date of contract execution, which is anticipated for August 2017, and end by September 30th, 2017. Phase 2 will begin on or around October 1st of 2017 and end by September 29th, 2018. Okay, so now what happens if you are ineligible to apply? You can see on the screen here, there are a number of opportunities that you could apply for through our partners. Our partners have actually received a similar grant to us from DASH. So they are also awarding microgrants, and their RFAs are similar. Their requirements are similar to ours. They will be slightly different and structured slightly differently, but most of their eligibility criteria will be the same. However, I would really, really highly encourage you to read all of their criteria very, very closely. The Advocates for Youth opportunity is working directly with local education agencies, so I would say you would need to partner very, very closely with your local education agency to be able to apply for the Advocates for Youth opportunity. The NACHO opportunity is probably the most similar to NCSD's opportunity, and instead of being for state health departments, it's actually for local health departments. So that may be an opportunity for you if you are in a local area that is not funded by DASH. So again, these opportunities through these organizations, all of the other requirements with the DASH restricted funding. So if you're in an area that is DASH funded, you will not be eligible for these opportunities through our partners either. And NACHA is actually holding an information session on Monday. It'll be very similar to this information session, but it'll be, of course, addressing their RFA and that opportunity. If you are interested in the School-Based Health Alliance opportunity, please email Suzanne Mackey to apply. She's our partner from the School-Based Health Alliance, and they have a very specific area that they are targeting, and you must be located in the southeast to apply for that opportunity, and they are focusing on funding their member school-based health centers, so you would need to partner closely with the school-based health center to be able to apply for that opportunity. We are by no means here at NCSD experts on each one of these RFAs. The people who are listed as contacts within each of these RFAs are the experts on these opportunities, and I would encourage you, if you are interested in applying for one of these, to contact them directly. Okay, so what are our expectations? So we would expect our funded health departments to attend and participate in a kickoff orientation facilitated by NCSD staff, and it's going to be located in Washington, D.C. Your travel for that will actually be provided outside of the grant, so it will be in addition to the $20,000. We would actually pay for your travel. You would develop draft action plans to support effective and evidence-based adolescent HIV, STD prevention programs, practices, and services. And again, NCSD would help you with the development of that action plan. You would host an in-person site visit with NCSD staff to participate in ongoing training and technical assistance calls and emails. You also participate in evaluation activities, including surveys, interviews, and writing success stories, and contribute to conference sessions as needed. You would also develop and maintain partnerships and coalitions to support improved adolescent health outcomes for HIV, STD prevention. You would also work with education agencies and other key stakeholders to implement action plans and to prevent adolescent HIV, STD infections. So just a few examples of some of the activities you could propose in your proposal, and that would be developing an action plan to implement a school-based STD program. You could propose to purchase curricula. You could focus on professional development for your staff or building the capacity of your staff to implement these school-based approaches. Okay, now some more good stuff here. Application deadlines. So, of course, the application was released on May 1st. We're giving about 6 weeks to respond. If you are interested, we do request that letters of intent, they are not required, but we would really appreciate letters of intent to apply to be submitted to us by May 19th, so that's a week from today. And then to have your final application submitted to us by June 9th. We hope to send award notifications by July 28th. It will be on or before. We'll start kicking off the project, as I mentioned before, in August of this year. And then the kickoff meeting will also be held in August of this year. And then we'll be conducting site visits to your health department in August and September of this year as well. Okay. So now I'm going to turn it over. We're going to start with the question period, and I'm going to go ahead. I have one question right now in the chat pod. I'm going to go ahead and read it out loud and then answer it. The question is, what if the health department has a partnership with an organization that acts in a fiduciary capacity to manage funds associated with a potential award? Is that allowable? I'm actually going to let Sarah answer this question, if you don't mind, Sarah.
Yeah, no problem. So for the purposes of this project, the application must come from the Department of Health STD program specifically. So if there's some sort of process in place or agreement to work with an outside organization, then that's just going to be an agency-specific situation, and you can reflect that in the application and budget accordingly.
Thanks, Sarah.
Sure.
Okay, I see another question. Yes, if you are in a DASH-funded state and you are a state health department, the question is a state who is already funded by DASH eligible to apply? If you are, like I said, if you are a state health department STD program and you're in a DASH-funded state, and you want to apply, you are ineligible to apply because you are already receiving DASH funds.
And this is Sarah. If you are a local or
question.
county health department in a state that is funded by DASH, then that's a different situation, and I would highly recommend that you look at the NACCHO opportunity.
Yes, if you are in a locality or a local health department, we would highly recommend that you look into applying for the NACCHO opportunity. Like I said, it's very similarly structured to the NCSD opportunity, but it's really geared towards local health departments. And another question, are we expected to develop our own curriculum for STD, HIV prevention education, or to use established curricula from CDC? We have curricula we can help you purchase if that's something that you're interested in. It would be curricula that is approved through CDC. And Sarah, I don't know if you have some examples you'd like to share.
Yeah, so I mean, it would obviously be a huge undertaking in a one-year grant period to
Sarah, are you on mute?
Design. Hello, can you hear me?
Did we lose you?
Can you hear me? Can you hear me, Lily? So it would be a big, okay, you all can hear me. I see in the chat.
Yes, now we can.
It would be a huge undertaking in a one-year cooperative agreement, or grant to design your own curriculum. So we definitely don't expect that to happen, but this is where a partnership with the education agency at your level will really come into play, and to figure out what they have in place already and where you can have the opportunity to improve that. And we have a lot of tools and resources to help with that, and to also identify what curriculum will make sense for your locality and in that particular context.
Great, thank you.
So, Lily, I can go through the questions here. If a local health department does not have an STD division but has an STD clinic, would the clinic need to be the applicant? So, again, to be eligible for this particular opportunity, we are looking at state health departments. So you must be an NCSD full member or a tribal nation. So if you are a local health department, then I would recommend, again, looking at the NACCHO grant opportunity to see what their eligibility criteria looks like, and probably join their information session to get more clarity around what they're looking for and how to navigate these particular situations.
And their information session is happening on Monday. If you are interested in that, please feel free to shoot me an email here. I'm going to put my contact information up here on the screen now. If you'd like to shoot me an email, I'm happy to send you that link so that you can sign up for that information session.
And the next question says, can you elaborate on the support from the educational institution? Does that mean that the school, Department of Ed, or community-based organization that already provides HIV and STD education? So if you are a state health department STD program, then this would mean that you're partnering with the state education agency. So the State Department of Ed, State Department of Public Instruction. I know each state kind of has its own name, and those are the folks that you would be partnering with within that agency The letter of support just needs to reflect that yes, they're on board to work with you and to partner with you on this particular initiative. It doesn't necessarily mean that they have everything in place already. We know that that isn't necessarily the case in many of your states, but it's just an opportunity that they're willing to partner with you to create an action plan to do this type of work. The next question, would it be possible to provide stipends for people living with HIV to participate in a panel discussions for school assemblies or to speak to classes individually about their experiences? Yeah, these are definitely creative ideas that I would definitely encourage you to explore in your particular applications, and this will look different on everybody's local context and what is going to make sense for you, and we'll be happy to support you with a needs assessment and figuring out what works for your particular community. So that's, as far as I know, allowable. Let's see. In a state that has some pretty severe travel restrictions for state health department employees, if we applied and received funding, would it be possible to have just someone from the Department of Ed attend the in-person meetings? We totally understand this. NCSD works with state health departments and state education agencies across the country and know there's a lot of barriers. So we would definitely be willing to work with you if you wanted to send somebody as your person, your stand-in for the in-person meeting. We also have some technology to be able to video chat you in to make sure that you're still a part of those orientations. And Lily will also be providing some on-site support to travel to you to make it a little bit easier. But we can attack that on an individual basis as well, just to make sure you get everything you need, because we totally understand there are restrictions.
Yeah, we will definitely work with you, and we will be flexible with what your needs are, for sure. Do you have any other questions? That's the last question I see in the chat pod. Okay, we have another question. I saw in the materials that food is not allowed. So this means if we host meetings with school administrators or parents, we could not provide dinner, etc., with grant funds. Yes, unfortunately, that is correct. There are a lot of restrictions on government funding and providing food, and those restrictions extend to these microgrants. Can the grant money be used to buy curriculum, or is it only for implementation? Yes, you can use the grant money to buy a curriculum. Yes, that is allowable. Just give everyone a couple more minutes if you want to formulate a question to enter it into the chat pod. Are funds, okay, new question. Are funds allowed to be used for compensation for program administration? Sarah, do you want to take this one?
I was just going to say, do you want me to answer?
Yeah.
So yes, funds can be used, if you're talking about staff time, they can be used towards that and for, any sort of logistical type issues, type things that go into administering a program like this. But it is only $20,000, so just keep that in mind when you're creating your budget.
Thank you.
And just to add on to that answer, there is more guidance if you read the RFA. We provide guidance about budget and all of the different components that go into your application. And I'll note that under budget, we do indicate that you cannot take indirect costs. So that will not be included in your budget. Are there any other questions?
And if you are just kind of absorbing all of this information and you kind of want to sit with it for a little bit, that's totally fine. Please feel free to email me, and I'm happy to answer any questions that you have. And I would,
answer this. Oh, go ahead.
No, that's okay. Go ahead, Sarah.
I was going to say I can answer this next question. Somebody asked, is the funding something that may continue after the first year of the program if it's successful? That's a really great question. Unfortunately, we are at the whims of the federal government in terms of funding, so that the answer to that question will very much depend on kind of where we stand in a budgetary sense. So I'm sure that you all understand that circumstance, but I will say that we'll be providing significant technical assistance, and we'll also provide some evaluation support. So you'll really be able to measure success of whatever you're implementing or developing at your health department. And so that should support you in identifying other funding opportunities beyond this and really highlighting some of the successes that you're able to do in this one-year opportunity. That said, if we do have further funding, we'll address that as it comes. So thank you for that question. That's great.
That's a great question, yeah. We really do have some robust evaluation activities that we do plan on doing, and we'll give you some great data takeaway, hopefully, with the project. So, hopefully you'll have some good proof of all the great work that is being done, even if it's just a short period of time. And then I just wanted to say, I would really encourage everyone to read the RFA very, very closely and in detail, because a lot of the questions you may have may already be answered in there. And then, like I said, I just want to repeat again that if you do have anything, I am here. If any other questions that are really just not covered in the scope of this RFA, I am really here to help you. So just feel free to shoot. Don't feel like it's a stupid question or a bad question. Every question is a good question. So another question, do you know the date in August you'll pick for the kickoff? How soon might you know? No worries. You can keep asking questions. That's fine. We don't know the date for the kickoff yet, but I would say that it will probably be earlier in August rather than later in August, just because we want you to be able to get your projects off the ground because it is such a short time frame. We want you to be able to get started right away. Do we have any more questions? I'm going to give everyone just one more minute to think about if they have any questions. If not, you guys can have some more of your day back. Okay, well, thanks everyone for joining this information session. I hope that it was helpful. I hope it helped to clarify some of the questions that you have. And I really do hope that you will apply for this opportunity if you are eligible. And again, feel free to shoot me an email or even pick up the phone and give me a call if you have any questions. Here to help. Okay, thank you so much, and look forward to hearing from all of you. Have a great day.